All right, what is up, my peeps? Joshua Smith here, back with another round with my good friend Jim Brown. What's up, Jim?
Not much, man. How you doing?
Doing good, dude. Doing good. I'm excited for today's topic, man. So you guys,
That's everyone.
yeah.
Sure.
We only have one of them, and it's important. What we're gonna cover today, guys, is we're gonna talk about overall heart health. Now, I'm gonna give the YouTube disclaimer here, even though I know a lot of you guys are listening to this too, but just the overall disclaimer that Jim and I are not medical doctors. Make sure that you're seeking advice from your medical practitioner and so forth. We're just a couple of dudes that are into health and fitness and just sharing our thoughts. So with that being said, I asked Jim to come on today with us and talk about overall heart health. I recently, and what spurred this is I saw a news article on CBS News, and then I did some other due diligence just to kind of vet some of the stats here. But it showed that between the ages of 25 to 44, heart attack deaths, not just heart attacks, but heart attack deaths are currently up 34% in the last 2 years. Now, prior to the pandemic, in this age group, heart attacks were actually on the decline. So they were declining from the baseline. Now, not only are they back to baseline, but they're beyond that by 30%. So there's definitely whatever may be the leading cause of that, and that's not really what we want to cover here on this podcast, because there's different camps, different theories, whatever. But it's just like, okay, the reality is this is something that's taking place, something that's going on. And again, I asked Jim to come on, just have a more in-depth conversation of, what can we do proactively to take care of our heart. With that being said, man, I'm just gonna, I don't know where you want to start this. I'll just keep rambling
I think
on
there's
here.
two things there that two different things to explore on this. That my personal belief is one is the standard of care. The standard of care, and we'll dive in that a second. The second is, lifestyle, and that would be related to body fat and, habits and eating habits and everything. And that's the one that we're probably more capable of controlling. You can control your body fat level, you can control your health. And like we always preach, and we've always said for years now, you need to unfat yourself and get in shape. And when you do that, if you're obese, certainly maybe even semi-obese, if you're 25-30% body fat, the first 10 pounds or so that you lose of fat, your biomarkers, meaning all your blood work, improves drastically. Doesn't matter how you do it. You could do it with high carb, you could do it with a Wendy's diet, you could do it however you do it. That first 10 pounds of fat you lose, your blood work, all your other biomarkers, inflammation factors, everything massively improve. And so, from that perspective, one of the first things that you can do is, unfat yourself, get off excess body fat into a range that I would consider healthy. And that for a woman, that's, somewhere below 20%. For a man, that's probably below, depending on age, below 15%. And
Which is what percentage of the population today in America? It's probably a very low percentage.
Well, I guess it depends on what state, city you're at, but overall, not very common. When back, I'm a little bit older than you, but when I was a kid, man, there wasn't a lot of fat people around. You would go to, the beach or the store or whatever. There'd be a couple, and I was a fat guy too. I was a fat kid, and I was one of the only fat kids that I had in the whole fifth grade. I didn't even remember. I don't think there was might have been another one or two, but I can't remember in my whole school, a kid that was really big and overweight. And I don't know, man, I think it's just so common now. I mean, God, we even got the pharmaceutical companies going after kids that they can use semaglutide, that kids can have lap band surgery. I mean, that's fucking ridiculous.
Yeah.
It's fucking child abuse.
Yeah, I saw a video today. I was gonna tag you in on Twitter, but I know you're busy. I didn't want to, bug you because it's during work day and so forth. But I saw a video and it showed young dude, young men in the 1960s. And it was PE, right? Like physical education of high school, dudes in high school. and they're out there, and showing all the extras they're going through and whatever. And like, you're just looking at like the shape that they were in, the difference that they were in, the fact that they even had PE back then, right, versus now, and just seeing the differences, of all, because you saw all the dudes there, participating in these, PE, physical education classes. And it was like, yeah, dude, I mean, all the dudes were freaking chiseled, man. They were all ripped,
It was like Marine boot camp. I saw that. It was like, it
Oh, you
almost looked like a
did?
boot
Yeah.
camp video. You're like, oh man, monkey
Yeah.
bars. Yeah, everybody's ripped. Yeah, I
Yeah.
mean, it was it's astounding, man. And it's one thing to say, well, it's just the food. I think that's part of it, the changes in food and how predatorial the food companies are, in developing things that are fucking hard to resist, hard not to eat. Sure, the advertising, all that stuff. But another thing is, I mean, like you said, PE and recess and all that. You saw that bullshit line they were trying to pass off, that climate change is making kids fat because they can't go outside. It's like, come
Yeah.
on, man. That's a tall order of horseshit. But yeah, to your point, man, kids spend more time on devices than they do outside running around, and that certainly has a massive impact as well.
So then, I mean, first, maybe let's kind of, before we get into, things that people could be proactively doing, that like, and correct me if I'm wrong here, but I've heard that, one of the big differences between the heart and other organs in the body is, and I can't remember if it's that the heart cells can't be replenished, or if there just is a much more difficult, slower process. Unlike you, like you can damage other organs and then they can recover from that, like the liver. Like you can go out there and maybe you're drinking like a fish for a while, but then you can, clean up, whatever. But where the heart, doesn't recover in those same ways. Like, once you have certain damage done to it, the likelihood of, that damage being reversed is very, very difficult to overcome.
Yeah, cardiac tissue is a little unique like that. And my general understanding is that, once cardiac tissue gets damaged, typically with, a lack of oxygen being fed to it, and it scars over, that's it. It's over with. It's done. You're never going to get that tissue back. The only benefit to that is, I don't believe that, I might be wrong, but I'm not sure that your heart can get cancer. And if it does, it's very, very low because the cell turnover is much different. And
Yeah.
it doesn't have that regeneration quality. And so, there's some evolutionary deals that go along with that. And your heart is very unique that way. But when you have a heart attack and you deprive those cells without oxygen and they die, and your heart function goes down, significantly, or a certain part of your heart dies, the part that was cut off from blood supply long enough, yeah, you don't get it back, and your heart is different after that. And that's one of the things that, I've been in the heart attack business for 15 years now. And, when you lose something like that, or you have a heart attack and you have even a small amount of cell death or tissue loss in your heart, man, your quality of life has changed. It's not coming back. So that's your new reality then. So it's man, I just can't stress enough that, once your health is gone, it's very difficult to regain if you can. And it's much easier to be on the preventative side.
Yeah.
I mean, eating
Yeah.
broccoli and running on the treadmill is a pain in the ass, but it's not as bad as having a heart attack at 40 and you only have 30% of your heart left, and you get winded walking out to your mailbox. So
Yeah.
prevention is much easier.
Yeah. Okay. So then, hopefully we can all understand the importance of this. Again, you only got one of them, then from there, okay, you started speaking about, obesity and not just obesity, but being overweight, and I had heard actually, Dr. Oz, right? Who I believe Dr. Oz, isn't he a heart surgeon?
Cardiologist, if I'm not mistaken.
Yeah.
Yeah.
Okay. Yeah. Yeah. So, yeah, and this was years ago that I heard him talking about this in the Dr. Oz show, but he was saying that, okay, for healthy for heart health, when it comes to like, and just kind of a good indicator, to go off of. I know you mentioned body fat, and he didn't mention body fat per se, but you start getting for men below 15% body fat, like I'm sure that this is just gonna happen automatically. But was that and what he stated is you want to have your waistline, and then your true waistline, like not what your pants are, for like dudes that wear their pants, like get that tape, get it around your belly button, around your love handles. Like your true waistline should be at no bigger than, it should be half your height or less. Right. And he went on to kind of explain the physiology of it, but it's like, okay, the second it gets beyond that is where it starts to put additional pressure on the kidneys, and where the cardiovascular, that just starts to overstress the cardiovascular system and put into overdrive. And that's where shit starts to get ugly, with that. You know,
Well, and I
it,
think that's that's in part, like I'm saying, unfat yourself, the waist measurement, all that. One of the major factors in if you look at the population, or you look at somebody and you want to say, hey, I'm going to guess just by looking at them if they have atherosclerosis, or if they have plaque in their coronary arteries, the arteries that feed blood to the heart tissue. One of them is age, right? The older you are, everybody has atherosclerosis, pretty much. We know from tissue samples that guys in the Vietnam War that were 18 and 19 had it, or have the beginning of it. We're able to see it now, in a test that we have, and it's very rare for somebody to have absolutely zero plaque. Guys are out there, but very small percentage of people. I think, very small percentage of the population. But the older you are, the more likelihood you're to have it. And then the second one that is relevant to what I'm talking about is diabetes. Right. So diabetes is a major comorbidity in you having atherosclerosis and heart disease. And so, how do we rate that, or how do you tell that? Well, if a person's overweight, if they're fat, if they have a large waist ratio comparatively to everything else, you're probably pre-diabetic, if not full-blown diabetic, and that's a major factor in you developing atherosclerosis and compromising your vascular system.
Now, are people
So
that are type 1 diabetic that, have to supplement with insulin, are they then more prone to heart disease if they're not, following good, healthy lifestyles?
I don't believe so, and especially if you manage it properly, because I've known quite a few type 1 diabetics, and they're not, there's some that are out of control, but for the most part, they're the ones that I know, super lean, in shape, got their shit together, because they've had to learn how to control insulin in their food and all that. And if that's the state, then I don't believe that that's a major risk. Could be wrong on that. I'm not really sure. So I don't know for sure. But type 2 diabetes, absolutely. And as you get older, those type insulin dependent type diabetics, the majority of them are like the people I know, the majority of them are overweight, poor health, and went through a whole disease process to get there to be insulin dependent. There's not like they were born with it. So yeah, not allowing yourself to be pre-diabetic or diabetic is probably the most powerful factor that you can control.
Yep. Okay. So then, and we've heard things like, obviously smoking seems to be a big, cause, which I know there's still smokers out there, but it seems like I don't know the stats on this, but it appears like there's less. It's like I remember as a kid growing up, it seemed like everybody smoked, but now very few do. But, smoking seems to be.
Depends if you hang around a Walmart.
Yeah.
But yeah, for sure. Smoking, another one. That's obviously increases your risk substantially. It's not so much of the nicotine, but it's all the product that's in the tobacco that's sold with the nicotine. And that's compromise your vascular system 100%. Raise your blood pressure, probably definitely above baseline, and that combined over 20, 30 years has major ill effects.
Okay. So then, okay, let's just say that somebody who's listening or watching this, and they're like, okay, like, hey, look, I don't smoke. I've got my body fat, under control. what are other things that people could do? And I made some notes before we jumped on here about things that we talked about in past podcasts that you brought up in past, just for overall health. And I don't know if this was, I couldn't remember offhand if this had to do with heart health or just overall, well, I guess cardiovascular health, but but I also couldn't remember if it was due to fat loss. But I know you brought up zone 2 cardio before, so when it comes to this, like, let's just say again, okay, so assuming somebody's not smoking, assuming somebody's, got their waistline under control, they're, at a decent level body fat wise, like if somebody was okay, like going above and beyond now, because I mean, we're seeing athletes. I mean, what was that athlete recently in the or not the Super Bowl, but the 24-year-old kid that, had a heart attack on the field?
Yeah, I don't, I didn't really know. I don't think we really know what happened.
Yeah,
To him, but
yeah, I guess maybe I shouldn't have
yeah,
brought that up,
certainly
but
unusual.
yeah,
Yeah,
I
certainly
mean, so it can
unusual.
happen in, healthy individuals too, but it's, but just, okay, let's just assume that, okay, like we got the baseline of those things done. I'm just curious of, like, is there, you know, X amount of cardio that we can be doing for X amount of time to ensure, in addition to our diet, is there,
Yeah, certainly. I mean,
goals for resting heart rate?
I don't know. I don't remember the exact stat, but it was something small, like, 3 times a week you're doing 20 minutes of cardio, which is it's very easy to do. It might have even been twice a week, but yeah, the benefits on doing zone 2 cardio are pretty substantial and well documented. And the easiest way that I can describe zone 2 cardio is you performing steady state cardio to the point where it's almost uncomfortable to hold a conversation. You're not killing yourself, but you can talk, but you'd kind of rather not. And that's the zone where all the magic happens. So if you're looking to just, you know, I mean, to probably have your body fat under control, you're doing exercise, you're doing some type of exercise regimen. And part of that should be cardio, even if it's just, 15, 20 minutes a couple times a week. Certainly if you're watching steps, I mean, 10,000 steps a day obviously helps. To get that in, you're probably going to have to do a walk or, not drive or, walk a couple blocks, whatever, any of that, just pick up the pace a little bit. And you're in zone 2.
Yep. Yeah. So I because a couple of months ago you were talking about zone 2, and I mean, I've heard the term, but I never looked into it, so I didn't really know what it
Yeah.
meant. But as I did a little bit of research after that podcast on it, it seems like it's ideal for the cardiovascular system, but also ideal for fat loss too,
Right.
from that cardio. So, I look to, I'm like, okay, well, because I'm just a guy, like I'm a statistics guy, like I like to know my numbers, and so at least from what I was able to find, it sounds like it's okay, 70 to 80% of your max heart rate, and then now I don't know if we can trust the CDC, but according to the CDC's website, they say to calculate max heart rate, take 220 minus your age.
Minus your age. Yeah. I
And
mean,
then
give or take, there's
yeah,
some outstanding individuals that, would be at the top of that number. But yeah, I mean, just general. That's why I don't typically use that number. But most likely, if you're in zone 2, it's uncomfortable to hold a conversation.
yeah,
That's a kind of an easy way to judge, and I think it's close enough. That gets you in
yeah.
the ballpark.
I mean, I like that too, because I'm one of those that, like, I hate wearing the fucking heart rate monitors when I work out and shit. Like I don't want another gadget. I
Yeah.
mean, I'll use another gadget if I have to, but it's like being in the
Right.
tech world, like I am, like for work, I'm like, dude, like when I work out, like I don't want to fucking have strapped on another gadget. Like I just want to clear my mind and work out.
Right. Right. Yeah, it's bad enough to try to fuck with your music and stuff.
So then how important is monitoring, because I know in past podcasts you talked about this, monitoring and paying attention to resting heart rate and making sure that's under, because I'm looking at, resting heart rate, and this is per the Mayo Clinic, but they say, okay, it should be, isn't it, from an adult somewhere between 60 and 100, you know, but then they say, okay, if you're an athlete, you might be closer to 40. Because I saw that 60 to 100, and I'm like, well, mine's 48, so I was kind of freaking out, like, shit, is something
That's
wrong?
pretty good.
But then they're
Yeah.
like, okay, well, if you're an athlete, it's going to be closer to 40. Then I'm like, okay, I wouldn't necessarily classify myself as an athlete, but you know, because like your blood pressure can be too low, right? So I was like, oh
Yeah.
shit, it's too low. Is it dangerous?
Well, yeah, that's a pretty rare instance, but most of the tip of the spear functional medicine guys, you know, they're looking to get your resting heart rate down somewhere below 60. And if you can do that, and you know, cardio is kind of the answer to that. Zone 2 cardio definitely helps with that. Doing cardio work, and I think overall that has, you know, according to them, pretty good data on heart health and overall health, vascular health. Of course, certainly watching your blood pressure. I mean, my pulse isn't, my resting heart rate isn't where I would like it to be, but it's always been a little bit higher. However, my blood pressure has always been in check. So kind of, you know, hard, even when I'm in really good shape, it's hard for me to drive down my HRV. But that being said, the things that you would do to get you there and bring your heart rate down are things that would get you overall more cardiovascular health.
Yeah. Yeah. And then the cool thing is, you know, I mean, most people now anymore have, you know, devices that it's so easy to monitor this stuff, you know, whether it be, you know, an Apple Watch or whatever. How often do you recommend checking blood pressure?
Actually, I have it sitting right at my desk, my blood pressure cuff, and I check it about once a week,
Okay.
especially if there's any changes in weight. Like I'm probably at the heaviest body weight I've been at in quite a while, and definitely concerned, you know, that my blood pressure was going up, and so I'll check it once a week just to make sure. Over this past year, when I was going through some massively stressful times with the job, I was checking it because I was concerned. It was up a little bit, but not to the point where, you know, I was concerned about maybe taking something to help bring it down. But I would think it, you know, regular intervals, and you know, if you don't have a cuff at home, I would say maybe once a month. If you're borderline, you might invest the $30 and get one for home use, and they're pretty accurate. Just keep
Yeah.
tabs of it, because that's one that'll sneak up on you and you don't really notice it. You know, that I mean, they call that the silent killer, but that, you know, high blood pressure has massive effects on your health, not only your cardiovascular health, but, you know, kidney health. So it's not good.
Yeah. I was just had a consult with, you know, the optimal health doctor, whatever you want to concierge, you know, whatever you want to call them, doctor that I go through now, because it's not an in-office visit, you know, they're not testing my vitals like a regular doctor might, you know, and they asked me, they're like, well, when's the last time you had your blood pressure checked? And I said, I'm like, dude, it's been a couple years. Like
Yeah.
you know, I didn't, you know, cause I mean, I'm checking all this other stuff, but then I'm like, well, shit, man, I probably, you know, I just need to probably get it, you know, hopefully it's good, you know,
30
but
bucks from Amazon, man.
like
Come
you
on.
said, it's a silent, and usually like
Yeah.
historically, like I just anytime I'm in like a CVS or a Walgreens, I just plop in there, and I know your arms won't fit those machines, but you know my little arms will. So but yeah, and then you know, blood pressure, what 120/80 is the target not to exceed.
For sure. Yeah. I think if you're at 120/80 consistently, you're borderline. I'd like to see it a little bit lower than that, but yeah, that's what the guideline says.
Okay,
Doesn't your Garmin watch do that, or it doesn't?
I don't think
Not,
it takes
I
blood
don't, it takes a
pressure.
row. Okay.
Yeah, no, I don't. I think you actually have to do the cuff, dude.
Yeah.
It'll
Okay.
tell me. So I got on here, yeah, resting heart rate. I've got on here, gives me, I don't know, says it calculates my stress levels, gives me his body battery, which I always tell the fuck off because it always tells me I'm
Yeah.
drained, which I'm never drained. I know my sleep score sucks though, dude. Like I
Yeah.
never get my REM every night sucks. You know, but you know, I don't know. I can't fully trust this because it'll tell me, oh, your sleep score is poor, but I'll feel great. You know,
Yeah.
tells me my breaths per minute. So I'm like 13 breaths per minute. Don't know if that's good or not. Um, so it gives steps, calories, pulse ox, you know, so like right now I'm at
Yeah.
96% pulse ox. So, you know, give some data, but
Okay.
yeah. Well, so okay, so you know, and those are kind of just KPIs to be watching for, monitoring for. But then from there, okay, he talked about, okay, making sure that you're, hitting that zone 2 cardio at least, 2-3 times a week. And I think that that's what I've heard too is if we're not talking necessarily for fat loss per se, which I don't even know if cardio is necessary for that, but just for cardiovascular health, I've heard kind of similar things of, like 20 minutes 3 times a week is, I mean, you can do more, but like it's amazing what that little bit will actually do for you.
Oh, I've had many clients, man, that they're starting in a really, really bad place. And we get them to do 10-minute walks after, 2 meals a day. Just 20 minutes a day. You can walk around your neighborhood, man. Take your dog outside and walk for 10 minutes twice a day. That's super easy to do. That improves you. That has effect on your health. So it's easy to do, man. It really is. And plus there's other benefits to that. The mental aspect of it. If you walk outside, Huberman talks about all the different, benefits of that, moving around in space, benefits for your eyes because you're focusing on different links, all that stuff. Not to mention, mentally, taking a break and especially walking outside is good. Even cardio insiders, you put on a podcast or whatever. It's that in the overall movement of your body. I have a client that's essentially sat in a chair for 55 years of his life and it fucking destroyed his body, man. And it's it's so bad that trying to reclaim it, now it's almost too late. I mean, it's definitely a limited capability was able to do, and that was because a guy sat in a chair for 55 years, literally.
Yeah.
So, listen, man, and I know this as well as anybody, I get really stiff in certain movements if I don't do them. And I'm a little limited. I kind of do the same things with my lifting routine, whatever. But if I go out and do some hard ass yard work or whatever, build a fence, cut down trees, and I'm moving in different motions and all that, it really, for lack of a better description, man, it kind of breaks up the rust. And then you're like, oh yeah, I can fucking move like that again. And so I think movement overall is just key to longevity and health. But that's another.
Is there a cardiovascular benefit meaning for heart health, cardiovascular system benefit of resistance training? I mean, my mind goes to thinking that there would be just because it gets,
Oh
the
yeah,
blood
absolutely.
flowing,
Yeah.
I mean, I know people talk about cardio with it all the time, but I would assume that there's some benefits there too.
Oh, absolutely, man. If you do you're doing a 20 rep leg press workout, or a set, that has massive cardio benefits for sure. Yeah.
Yep. All right. So okay. So assuming that, everybody's, got the body fat at a good healthy level, got the waistline down, hitting that zone 2 cardio, doing the things that we talked about, then they're monitoring this stuff. Then what about supplements? Or specific things when it comes to diet, right? Outside of, okay, eat so you're not gaining body fat, but are there certain, like when it comes to diet with, I don't know, we've all heard or indoctrinated that about vegetables. And I don't know if there is if there's certain foods or certain supplements, like I was, before we jumped on here, I was kind of, just doing some Google searches and, heard things came up like CoQ10, omega-3s, magnesium, for improving heart health. Are there certain specific supplements that you recommend or certain specific foods that can, help be proactive, with overall heart health?
Yeah, I think those are definitely the ones you mentioned are definitely the most popular, and the ones that I think you'll find most everybody agrees on recommending. Um, as far as a diet, I think overall the Mediterranean type diet is most supported in I think most people would agree with that, if you're a functional medicine person or even, a more educated standard of care person. I think that the Mediterranean type diet where you're olive oil, whole foods, there's a lot of color on your plate, all that. It's not a lot of processed carbs. I think that's probably overall the best way that you can eat. And we kind of dial that in a little bit more with a high protein diet, as many vegetables as you want, fruit, as needed, just whole single ingredient foods and intelligent fats. And that has it's going to keep you in a lower inflammation state, I believe, overall systemically, and it's going to help you control your weight and your body fat, which really is one of the strongest predictors. It's going to, keep you out of that diabetic range. That I think is the most influential, or at least one of the most influential factors.
Yeah. Yeah, because I know, I mean, in the years we've known each other, even from our first conversation when I started picking your brain about supplements, I mean, those three were on top of the list. CoQ10,
Yeah.
omega-3, magnesium. You're always preaching them.
Yeah, I mean, I would add on to that, vitamin D, and then whatever it takes to get your hormones up to date, as we had in the book, if you have suboptimal testosterone levels or suboptimal hormone levels, it has effects on your cardiovascular system as well. So there's a lot to be considered, a lot of things that you can look out for. But I mean, the diet, the body fat, the move around, do some cardio, take some basic supplements. That's all easy stuff to do, man. But if you look at most of the people, and I've seen a lot of people that are in the system for either bypass surgery or stenting, or last to that, the end of the road heart failure and transplant. For the most part, those people are older and in very poor health, man. They're just really poor health, and they all, for the majority of them, look like they're pre-diabetic or full-blown diabetic. Have strong genetic history, and it doesn't. I think it takes a lot not to be a statistic. The first thing is to have a proactive doctor. Have somebody that's actually going to check the disease that you have, not just take your blood work once a year and call it good. And then control the things that for sure will affect that. And you don't have to be a genius to think that, hey man, if I take care of myself, I keep my body fat down, I'm in shape, I work out, I don't do these things to the extreme, I don't take, I'm not using these drugs, I don't smoke, overall I'm taking care of my health. And for the most part, that works.
Yeah. I mean, really a lot of the stuff, dude. I mean, outside of, understanding the monitoring or but it's like all this shit's just kind of common sense fucking health, stuff.
Now there's some things, there's a lot of failures too, right? So we'll talk about the medicine side of it. Standard of care for heart health, right? You start with your general practitioner, and they take your blood work. And if your blood work, you come back with high cholesterol, they want to put you on a statin, because that's, those are the guidelines. Well, that doesn't, we still don't know if you have atherosclerosis or how much you have or what type it is. And then if you put you on a statin, we're not going to check really to know if it's reducing, if it's transforming the plaque, if it's doing anything with that. We're just going to look at your blood work again to see your lipid levels went down, and think that you're good. So in the standard of care of medicine, that's a huge swing and a miss, man. That's just treating on what we call population health, and it doesn't work for people individually. And that's why, the advent of statins hasn't cut heart attack risk. It did. The metadata that I had last looked at said if you were on statins, you're going to live 5 days longer and have a poor quality of life. So it's a failure. Why every 36 seconds is somebody dying of a heart attack if widespread statin usage worked? Well, it doesn't. It's a failure because you're not able to see and measure and the atherosclerosis to know if you should really be on a statin or not. We're playing the blood lipid, the blood work numbers. Secondly, you'll be on, if you're under the care of a doctor, you might be growing arterial plaque and not know anything about it. Hey, I'm on a statin, my cholesterol's under 200, my doc says I'm doing good, and then all of a sudden you have a heart attack, or you start to get chest pain. Well, when you get a chest pain, then your doctor will say, hey, you need to go to your cardiologist and get a stress test. Well, a stress test is just testing you to see if you have a stenosis, which is a narrowing of your artery that's so great it causes you chest pain when you exert yourself. Well, if that happens and you test positive for that, they will go in and do a live catheterization where they'll look at it and actually see what is going on for the first time, and put a stent in, right? So wherever that stenosis was, they're narrowing the artery, they want to put a stent in, which is basically a little mesh tube that's expanded in your vessel and opens it up. Well, stenting doesn't save lives. If you're in the midst of a heart attack because you have narrowed arteries that in one spot called the stenosis, and it's so great that you're having a heart attack, yes, certainly opening that up stops the heart attack. But overall, this prevented, this stenting method, it doesn't save lives. It doesn't stop heart attacks because we're still having heart attacks. In fact, I would argue that once you have a stent, you're going to develop disease faster. So anyway, that's a standard of care. That's kind of your pipeline as a patient. Start with a general practitioner. They treat your blood lipids. Nobody knows if you have disease yet. And then when you develop symptoms, then a cardiologist checks if you can put a stent in, and they do, and then they send you back home. So really, you've done nothing. You've done nothing there. When you go to a more proactive type functional medicine or somebody who's more tip of the spear, there's ways now to actually look and see if you have atherosclerosis. One of the older methods that's still widely available and used is a coronary calcium score. There's other tests now, like the company I work for, that will look at, you can actually see the soft plaque that you have as well as the calcified plaque. And so there's ways that some of the physicians will do an ultrasound of your carotid to see if you have atherosclerosis and treat you that way. Still, these are all methods. Some may be better than others, but these are all methods where we're actually looking for the disease, and then based on those findings, treat you, whether it be, lifestyle changes or, a supplement routine or statins. Then they have a way to recheck or see if it's actually working in transforming that plaque to hard plaque, or if it's reducing the amount of plaque that you have. And that's different, totally different approach than a standard of care. And so there's data, there's studies out there that Scott Hart trial is a big trial that shows, that type of intervention of actually trying to see the disease and then treating it if you know that you have it before you have symptoms and have a stress test and get intervened, you have a massive reduction in heart attack. So a couple different things there. I know that's a lot to, it's a lot to brush over in a 2-minute speech, but that's it.
Yeah, but why is the standard of care, meaning the statin, and like why is that still the standard of care when there's more superior technologies and tests that can be done today?
Yeah, a couple things. CT scanning has come a long way in the last 10, 12, certainly 20 years. And I don't know when it was really first started, but probably, rough numbers, late 2000s, somewhere maybe a little bit earlier than that. CT got to the point where you could get a coronary, just like a coronary scan, like a heart scan with a CT scanner, and physicians could look at your coronary arteries and see if you had disease. And one of the first pioneers in that was a guy named Dr. Agassiz, and he came up with a South Beach diet. He's famous for that, but he also created this calcium scoring method. And that was a way that you could get this CT scan done. And then somebody will look at that manually, measure how much calcified plaque you have, and then we could come up with a risk assessment based on that. And that was great. That was the first time that we were actually looking for and seeing the disease and then treating you based on that, not just whatever your blood lipids say. Because you'll have guys that have outrageous like hyperlipidemia, where your lipid numbers are sky high and they don't have any disease. Or you have somebody like me, total cholesterol's never been over 160. I have atherosclerosis. Would have never known it before, would have never treated it. But now that I know I have it, I'm way ahead of the game by treating it. So that was really the first time that we were able to kind of look at it and see. And since then, CT technology has come up a lot in the advent of computer and the ways to process that. But now we're able to do, a CT scan and see even more in more detailed view and process it differently so you can see everything. And so I think really back then, didn't have a way to do it. And so that's how kind of part of that, I think in part, that standard of care was like, okay, let's do a stress test and we'll see if you have a stenosis. Otherwise, they didn't have a non-invasive way to really tell how much plaque you had. That was kind of the first way to say, okay, well, you have a stenosis, that's going to be an issue. We're gonna go do a live cath, and that's where they take you in the cath lab. They'll put you under fluoroscopy and then hit you with a shot of contrast and actually see your arteries see if there's a narrowing that's so bad it's causing stenosis, or see if there's so much plaque, they feel like they have to do something about it. But when you hit that point, it's not like you can just say, okay, man, we need to get this guy to stand. It's probably at the point where they're going to have to open it up manually. And, you're so far behind the disease by then. That's why, cardiac disease is it's the number one killer. We really haven't had a way to see that before, but things are changing.
Yeah. Yeah. No, it's exciting stuff, dude. But even with those technologies now, it's like, I mean, that's a lot of this stuff isn't even covered by insurance, is it?
No, but just like this game, man. I mean, we've had to been cash pay patients for our testosterone or our optimization of hormones forever. I mean,
Yeah.
can you find a doctor that'll write it and your insurance cover it? Maybe.
Well,
It's
and
very hard, very
yeah, that's where
difficult.
and that's where my question was kind of leading to is, yeah, I mean, I even have, medical insurance for my family, which we don't even really ever use. We have it
Right.
just in case, but it's like to my wife and I, dude, it's like, 12 grand a year to work with our concierge physicians,
Yeah.
and that's between, also supplements, right, that
Right.
we
Right.
get from them and, so forth. But it just seems like, all the real shit that really impacts, that really matters, that's really effective, dude, for some reason, insurance companies, hopefully that changes though in the future. But it seems like they, it always blew my mind where now I don't know a lot about this stuff, but when I was in my early 20s, I worked in a hospital. And for the first year that I worked in the hospital, I was a transporter in the radiology department. And but it was like the cath lab was there where they do the stents and I could see the procedures taking, right in front of me taking place. And, and the technicians would sit there and talk about how like, hey, like even like the insurance companies wouldn't cover an echocardiogram to check calcium buildup in the heart that might cost $300 or $400, but they'll cover a $45,000 heart stent, and it was just always seem ass backwards, right?
Well, yeah, it's kind of how we're in the position we are now. We don't have clinician-based decision making at the general, at the physician level. It's insurance-based decision making. When you talk to a general practitioner now, they're not sitting you down and going, okay, let me figure this out. I'm going to diagnose you. It's literally, hey, I'm going to go through this checklist that the insurance is dictated on how to treat you. And that's why so many physicians are turned off, and doing other things and moving to concierge. When you move for the most part, when you move to a concierge physician, you don't have the insurance telling you, hey, this is how you're going to diagnose and treat the patient. You can actually go back to being a clinician and saying, hey, let's figure this out. Okay. I don't have to see 20 people before noon, or 40 people, or sometimes 100 people in a day. I'm seeing, maybe 10 people today, or I'm seeing, in some cases really high end, I'm seeing 4 people max today. That's because they can sit down and actually go back to diagnosing you almost, like the old country doctor would like, okay, tell me about this, and go through your whole complete history and figure it out. Things are changing. I think the advent of technology is, especially in part what my company does. And what we do with CT images is only possible because scanners have been, the advancement of scanners has come up so drastically in recent years. And I think and we're seeing the changes, like the guidelines are changing. You're seeing cardiology practices now changing that are getting away from functional stress testing, and they're purchasing CT scanners to have in their office. And so I think you're going to see a paradigm shift there. And I would hope that would lead to, better decision making and decision making based on actual disease seen, and not this population health where we're just treating blood lipids.
Yeah.
And
Yeah.
there's
Yeah.
testing that way in all aspects too, like cancer testing. There's a test called the Grail. It's not perfect, meaning you can take this Grail test and it will tell you if you have cancer. I guess to that, it's very accurate. It'll tell you if you have any type of cancer. However, if you don't have 2 cells of cancer on the day of the test, it's not going to pop. In a week, then if you have 2 cells of cancer, you've kind of missed that, so it's something that you want to do at regular intervals. And I might be messing that up, but I think that's the overall gist of it. But it's real exciting, man. I mean, we're getting to these technologies and these advents that I think you're really going to be able to have real individualized care like that, where you're going to have your Garmin watch and it's going to be capable of a few more things. And you're going to send that to your doctor, and that's going to go into an algorithm. And they're going to have your CT scan, your this, your that, your blood pressure, all that stuff, and spit out, hey, man, this is exactly where you're at risk. This is what you should do. You should bring down your body, just more individualized kind of care based on your genetics. Hey, we did your DNA testing, and we're going to consider those factors. And I think all that information, it's a tremendous amount of information, and it's even more of a task to tie all that in to an individual. But there's companies now who are working on doing that, very high end companies that are getting all that data together, accumulating it, and giving you a personalized treatment program and risk profile. And those companies are going to get bigger. That's going to integrate, and eventually all the costs are going to come down. I think that's going to be more available to people, but it's pretty exciting in that aspect.
Yeah, no, that is it, 'cause it seems like, from a very broad scale, from a very high level, where the system seems to really fail is where it's the same standard of care for everybody, right? Not personalized care like you're talking about. It just ends up being the same
Right.
protocol. Okay, like, everybody get this thing. Everybody has to do this without um, um, and maybe there's reasons for that, but it's like, dude, like human beings are complex, and being able to have that individualized care, and that's why the concierge medicine has been so popular, right? Where it's like, I can sit there and based on everything I've got going on, I can have those conversations with my physician from diet to supplements based on my own markers, so
Well,
yeah,
if you look at, from the insurance standpoint, I think the stat that I heard is an insurance company doesn't expect to cover you more than 2 to 3 years.
yeah,
Your run with them is very short. So why should they invest in your long-term health? Doesn't make sense on paper. It doesn't make sense on the Excel spreadsheet. And so, I mean, that's that's a massive factor, man, on how they're going to take care of you. And especially then, if they're dictating healthcare, you're not you're not worried about 10 years down the road. You're going to treat your symptom today and get you out of the door. Really, that's it. And that's why that's happening.
yeah. Yeah, and until that time comes where, that well, not even when that time comes, but and this is stuff that we always preach on this podcast, but it's the importance of, you know, having the knowledge and the wisdom, at least enough to take this stuff in your own hands,
Well, look, man, I mean, just like everything, right? I think anything in life, when everybody's headed right, you should go left. It
yeah,
just is. So, just apply that to apply that to everything. When you're in the grocery store, look around, man. The people that you don't want to look like, look what's in their cart. I mean, look what everybody's buying.
yeah.
I mean, it's kind of simple in that aspect. Don't do what everybody's doing.
Well, and I've looked at it like this of, whether it be my health or my money, right? Which I kind of treat them both the same, where it's like, like, okay, everybody that I know that's got kind of fucked over financially, if you will, and not everybody I know, but I think the riskiest thing to do is go out there and hand off your money to some money manager that you've never met that's supposed to be investing your money. It's like this over the last couple of years, man. I've met so many people that are like, oh, my 401k got crushed. I'm like, okay, well, what'd you do? Like, well, I don't know. I met with this advisor here and, okay, well, like, what are they like? But they have no education on it. I'm like, okay, so you're working, you worked your whole life, you hand over this money to some stranger that you're just hoping invests your money that's not their money, and right? But same with their
Yeah.
health. It's like, okay, like, like know enough and be proactive with this stuff, with your health and your wealth, I guess, if you will, to go out there and make those decisions, dude. If you want to delegate, because at the end of the day, it's like, okay, if you don't, it takes money to live, and then we got to have our health, but like you can't delegate everything, right? Like, when people come to me, even when it comes to, health and fitness, like, oh, like we look at the new food pyramid that we covered the other day. Okay, well, if you don't have the foresight to go through and do your own due diligence to know that, okay, eggs maybe aren't worse for you than Honey Nut Cheerios or Frosted Flakes, is the food chart tells you, well, you're gonna probably go down a certain path.
Yeah. Yeah. I mean, like anything, I think when you're trying to get to the truth or have an understanding of it, you can't just, like, oh, my doctor said I was okay. Hey, I had my physical, everything's great. What they do, check your blood pressure, fucking do some half-ass blood work and just make you stick out your tongue and then bump your knee with that thing. I mean, literally, what is a general physical? It's almost absolutely useless, you know. But some people will do that. I've talked to people, oh no, I get my yearly physical, I'm good. Okay, man, there's not much I can do for you then. I can't, this is too long of a learning curve. You're just so far behind. I don't even know how to respond to that. But for some people, that's them. Then they kind of can check it off. I'm okay. I don't have to worry about it. But it's not the case, man. It's not the case with anything.
Yep. Yep. 100%. All right, man. Well, as we wrap up here, any anything that we left out, any kind of ending thoughts?
No, man. Unfat yourself, eat healthy, and do some cardio, man. Yeah. Once you lose it, it's very difficult to get back if you can. So, and some of you who've had, either major accidents or had, massive health issues and came back from that, will understand that. But it's much easier to take care of it on the front end than to deal with it afterwards.
Now, when it comes to that CoQ10, omega-3, and magnesium, are those three supplements? Well, you also mentioned, vitamin D or D3, and then you talked about hormones, but with those supplements, we'll just throw in CoQ10, omega-3, magnesium, I guess D3. I mean, is that something that you would recommend everybody go out and start taking right away?
Yeah, for the most part, those are all safe. Omega-3 for some people at higher doses, you could have a slight reaction to with an arrhythmia, but for the most part, I think they're pretty generally widely accepted supplements and all have benefit. And I would say that most everybody would benefit from taking those. Yeah, probably
Yeah.
magnesium on top of that, if you wanted to. But yeah, it's a great way to start. If you know you have heart disease or you're suspect of it, I mean, I would probably add in aged garlic, but yeah, that's a good place to start for sure.
Yep. Awesome. All right, man. Well, as always, Jim, we appreciate your time. Appreciate you being here with us, dude. This has been awesome.
Yeah, man. Yep. Good conversation.
Yeah, 100%. Those watching and listening, as always, we truly appreciate you being here. Truly appreciate your support. Keep crushing, keep kicking ass, and we will see you next time. Peace.